Hi guys, today I wanted to talk about a topic that is a little bit, well, actually I would say a lot taboo in our culture. The discourse has been that it primarily affects men, but I would say that it also affects women as well. And this is the issue of paraphilias. What are paraphilias? A paraphilia is basically an intense sexual attraction to objects or people that are outside of consenting adult partnerships. I'm going to list off the paraphilias that are listed in the DSM, so I will list them all. But just to go into some detail about it, to be labeled as a paraphilia, we have to have been experiencing these symptoms of attraction for over 6 months. And there also has to be clinically significant impairment to some type of social functioning, social norms, or even occupational functioning to be labeled as having a paraphilia. I believe there is a difference between having a fetish and a paraphilia, or having a sexual preference that is within healthy, consenting sexual boundaries with an adult, consenting, like I say, partner. So, in the DSM, there is an entire section devoted to paraphilias, and the ones that are listed are voyeuristic disorder. So that is intense arousal from observing someone who is basically unsuspecting, so being a voyeur. The next one is exhibitionistic disorder. So that is intense sexual arousal from exposing yourself or exposing your genitals to other people or unsuspecting people. And quite often we'll hear about people who are flashers. Those people would be considered to be exhibitionists. The next one is Fraughteristic disorder, less commonly known about, but this is a disorder where someone is aroused or they get great sexual satisfaction from rubbing themselves on other people or touching other people who, again, are unsuspecting. So the big thing about paraphilias and the common denominator that quite often links them is that these people get sexual arousal or some kind of sexual gain from non-consenting interactions that are in their minds highly sexualized. So this one is Fraughteristic disorder, and I will just read a little bit about it from the DSM as well, is recurrent and intense sexual arousal from touching or rubbing against non-consenting people as manifested by fantasies, urges, or behaviors. And people have to have acted on these urges as well to be labeled with a Fraughteristic disorder. Sexual masochism disorder is one that's quite commonly known about, but it's to do with recurrent and intense fantasies or sexual arousal from being sexually or in some way humiliated, beaten, or abused, basically. There's also some links here to things like bondage, those kind of things. Sexual sadism disorder is kind of like the pairing to sexual masochism. So these people get off on harming or having power and control over other people. They get intense arousal from physical or psychological suffering of other people. So where I distinguish a difference for me in my own practice as a paraphilia versus a sexual preference is if someone is a sexual sadist and they are consensually engaging in some sadistic or some BDSM behavior with a consenting other adult, that is not so much for me a problematic behavior that I would label as paraphilia or a paraphilia type disorder. But if someone is a sexual sadist and they are getting that satisfaction in a way that is non-consensual, if there is like any form of sexual assault or non-consensual sadistic behavior, that is where I would draw the line there. Just for me, in my own practice and understanding of paraphilias. A big one that we get into now is pedophilic disorder. This is probably seen as one of the worst subtypes to fall into under these paraphilic disorders. And socially, there is no acceptance and no ability on the part of children to consent to sexual acts. So even engaging in observing any kind of pornography or photography or anything that involves children or underage people would be considered to fall under this category. Fetishistic disorder is when people are attracted or have sexual fetishes regarding objects or non-living items. So this, for example, could be things like underwear, and people feel an intense attraction to those things. Sometimes they actually cannot be aroused or feel that they cannot be aroused unless those objects are present in any kind of sexual or stimulating interaction. Transvestic disorder, arousal from cross-dressing. This, I would argue, is not always a disorder. It can be based on gender identity, but I guess the difference is if there's extreme sexual arousal from this behavior, it may fall under paraphilic label. And then we go from there into there are other specified and unspecified paraphilic disorders. So I just wanted to touch on this subject today because I think it is an important one to talk about in mental health and to understand and know what these disorders are. Treatment options for these types of disorders can be anything from exposure therapy to behavioral intensive types of therapy, but I really recommend seeking professional help if you are dealing with this, and probably from someone who specifies in working with specifically paraphilic disorders or sexual issues in their practice. There are also medications that can decrease certain amounts of testosterone in the body that some people believe are factors in causing more of this paraphilic behavior. So those would be things to talk to a physician or a psychiatrist about. The causes of a paraphilic disorder can be so vast and varied, and there are ranges from kind of trauma to simply just being exposed to a certain stimuli, often early on in life, that maybe had some type of sexual connection for you. So if you are struggling with this or you are struggling with a paraphilic disorder, reach out for some help. Don't let this control your life and take over in your social, relational, and also occupational functioning. Thanks so much for watching this week, you guys. I do have some resources online to help deal with various issues from anxiety to depression to being more mindful in our day-to-day. So don't forget to check out my websites and all of my other information online. Thanks so much.